With that, quite an extensive resume. We are honored to have you, sir, and the floor is yours.
Thank you very much. I'll Okay, you can see my slides okay?
They look fine. They're
Yeah.
there we go. Now you got it.
All right. Uh, well, it's good to be here. Thanks for giving me some time to share with you information about the health effects of soy foods and soybean components. I've been doing this, as was just noted, for more than 30 years. I find the field to be absolutely fascinating. There's so much research being published that really forces you to keep up with the literature. As you all know, soy foods have been consumed for many centuries, beginning first in China and then spreading to other Asian countries such as Japan. But in addition to the traditional Asian soy foods, there are the modern soy products that are made with one or more soy ingredients, soy protein ingredients. These ingredients range in protein content from 50% for soy flour to 90% for soy protein isolate. These ingredients are used as a base for making meat and dairy substitutes, and they're also added to a wide range of commonly consumed foods in order to boost protein content. Soybeans are really different from other legumes in terms of their macronutrient composition. As you can see here, most beans are about 26 to 28% protein on a caloric basis, whereas some varieties of soybeans get as much as 42% of their calories from protein. Most beans are also just about fat-free, maybe 2 or 3% fat on a caloric basis. One exception is garbanzo beans or chickpeas. But you can see soybeans get nearly 50% of their calories from fat. So in addition to being higher in protein, soy protein also is a really high quality protein. So I want to focus on that aspect for just a couple of minutes. Of course, when we think about protein quality, we're talking about the ability of a protein to meet the biological requirements for indispensable or essential amino acids. Now, two factors determine protein quality: digestibility. Obviously, if you can't digest the protein into its either dipeptides or single amino acids, you're not going to be able to absorb those amino acids. And then the other one, and more important one, is essential amino acid content, because essential amino acid content plays a much bigger role than digestibility, because most proteins are fairly well digested. The standard method for evaluating protein quality, the method used by most regulatory bodies around the world, including here in the United States, is the protein digestibility corrected amino acid score. This method simply uses the two factors I just discussed to determine protein quality. The highest score using this method is 1.0. That's the score that soy protein isolate receives. You can see that soy is a little bit higher in quality than beef and much higher in quality than the other plant proteins listed on this slide. Now, some of you, or perhaps all of you, have probably heard the term complete and incomplete protein. Complete proteins are said to contain all essential amino acids, all 9, whereas incomplete proteins contain some, but not all of the essential amino acids. That concept is actually complete nonsense, because all of the proteins contain all 9 of the essential amino acids shown here. It's just that some proteins are low in one or more essential amino acids relative to requirement. In fact, if a protein was missing an essential amino acid, it would have a protein quality score of 0. And you can see here that none of the plant proteins have a score above 0. Now, almond is a really low quality protein because it is very low in one of the essential amino acids, but all the proteins contain all 9 essential amino acids. One of the questions that often comes up is how soy stacks up as a source of protein for building muscle and increasing strength. And I can't emphasize this point enough. Resistance exercise is the key to increasing muscle mass and building strength, although additional protein, dietary protein, can help. So experts recommend consuming about 1.6 grams of protein per kilogram body weight. That is double the protein RDA of 0.8 grams per kilogram body weight. Now, whey protein, which is 20% of the protein in cow's milk, is often considered to be the optimal source of protein type for building muscle, because whey is high in one particular branch chain amino acid, leucine, which is one of the key triggers for muscle protein synthesis. But soy really stacks up as well as whey and other animal proteins when it comes to building muscle. Here we have the results of a meta-analysis of 9 randomized controlled trials that was published in 2018. And the authors concluded, and I'm one of the authors just for transparency, soy protein produces similar gains in strength and lean body mass in response to resistance exercise training as whey protein and other animal proteins. Now, if you're distrustful of the meta-analysis for some reason, maybe you'll take Arnold's word for it. In a recent newsletter of his, he noted that a soy-heavy vegan diet supports muscle growth and strength just as much as an omnivorous way of life.
When did he start doing that, though, the vegan?
He's not a vegan himself. In his newsletter, he was citing research to show that soy protein was an excellent source of protein for building muscle.
Yeah, it's not what he did, though.
No. But, and I don't blame him, because again, animal protein and whey protein, until maybe 10 years ago, were really thought to be the ideal choices for building muscle. That is no longer considered to be the case. In fact, in the one paper that I showed you that indicated you need to double the RDA for protein source in that paper, and that's all the big folks in that field are co-authors in that paper. In that paper, they note that protein type really plays a minor role in building muscle. And that's what this slide is meant to illustrate. The key is resistance exercise training, hands down. Total protein intake can be considered the icing on the cake, and protein type perhaps the cherry. So the key is exercise, then total protein, then protein type. In addition to being a high quality protein, soy protein also lowers blood cholesterol levels. It's not a huge effect, certainly in comparison to statins, but you get about a 3 to 4% reduction in LDL cholesterol levels. The first clinical study showing soy protein lowered LDL cholesterol was published in 1967, so several decades ago.
What would be the significance of this, of lowering
clinically?
Yeah.
Well, I'm going to comment on that, but it's thought that over time, each 1% reduction in LDL lowers risk of coronary heart disease by 1 to 2%. So it's a modest effect, but I think certainly at the population level, it's very relevant. And then I'll talk in just a bit about why soy foods are especially relevant for coronary heart disease prevention. But I do want to point out that this is a direct effect of the protein. It's not because soy foods tend to be high in polyunsaturated fat. I'll talk about that in a moment. So this ability of soy protein to directly lower blood cholesterol levels was formally recognized by the U.S. Food and Drug Administration in 1999 when it approved a health claim for soy protein and heart disease. The claim reads 25 grams of soy protein per day as part of a diet low in saturated fat and cholesterol may reduce risk of heart disease. So I mentioned at the onset that soybeans are quite high in fat, so it's important to have some understanding of the health effects and fatty acid composition of soybean oil and also the fat in soy foods. Soybean oil plays a huge role in the world and US food supply. It's the #2 edible oil consumed in the world behind palm oil. And in the United States, it's not even close. It's the #1 edible oil consumed. And incredibly, soybean oil accounts for over 7% of the calories consumed by Americans. So as you know, polyunsaturated fat lowers blood cholesterol levels when replacing saturated fat in the diet. So it's not surprising when you look at the fatty acid composition of soybean oil that it lowers blood cholesterol levels. And in fact, in 2017, the US Food and Drug Administration approved a health claim for soybean oil and heart disease based on the ability of soybean oil to lower blood cholesterol levels. It has a low amount of saturated fat, 16%, a moderate amount of monounsaturated fat. The predominant type of fat is polyunsaturated, 62%. And importantly, soybean oil is one of the few good plant sources of both essential fatty acids, the omega-6 essential fatty acid linoleic acid and the omega-3 essential fatty acid alpha-linolenic acid. In fact, because of its widespread use in the United States, soybean oil accounts for over 40% of our intake of both essential fatty acids. It would be difficult for many Americans to actually meet their essential omega-3 essential fatty acid requirement if it wasn't for the use of soybean oil. Now, walnut oil, which is not readily used, is a good source of both essential fatty acids. Flaxseed is as well, and is canola. That's a good composition as well. So I mentioned that soy protein directly lowers blood cholesterol levels. David Jenkins and colleagues from University of Toronto published a paper more than a decade ago now in which they looked at the intrinsic and extrinsic effects of soy foods on LDL cholesterol levels. So the intrinsic effect is a direct effect of soy protein. The extrinsic effect is what happens when you consume soy foods that are high in polyunsaturated fat in place of protein-rich sources that are high in saturated fat. And he estimated that when you're making that kind of substitution, that you're going to get anywhere from an 8 to 10% reduction in LDL cholesterol. I think that might be a little high of an estimate. I think it's probably closer to 6 to 8%. But again, if you consider that every 1% reduction in LDL over time is thought to reduce risk of heart disease by 1 to 2%, a 6 or 7% reduction is certainly significant. I mentioned that soybeans are very different from other legumes. They're actually different from all other foods. And that's because they are a uniquely rich source of isoflavones. And I entered the field in 1989 because of my interest in isoflavones. I was working for the National Cancer Institute here in the United States. If you're interested in isoflavones and you're a nutritionist like I am, you're going to be interested in soy foods. And you can see how unique they are because isoflavone intake in Japan, where soy foods are commonly consumed, is about 30 to 50 milligrams per day, whereas in the United States, Europe, and Canada, it's no more than 3 milligrams per day. So for comparison, one serving of a traditional Asian soy food, such as a cup of soy milk made from whole soybeans or 3 to 4 ounces of tofu, provides about 25 milligrams of isoflavone. So you can see in Japan, they're consuming between 1 and 2 servings of soy per day. You can come up with a pretty good estimate of the isoflavone content of a traditional Asian soy food if you know the amount of protein it provides, because they're about 3 to 4 milligrams per gram of protein. So if you consume a cup of soy milk that has 7 or 8 grams of protein in it, you're going to get about 25 milligrams isoflavones. Isoflavones are naturally occurring plant compounds. They're actually present in a wide range of foods, but with the exception of soybeans, they're present in negligible amounts. They're commonly classified as phytoestrogens or plant estrogens, but they differ from the hormone estrogen. Clinically, that's how they affect tissues, and at the cellular level, how they bind and activate estrogen receptors. those of us in this field have tried very hard to educate folks about isoflavones being very different from the hormone estrogen, but many times we've been very unsuccessful at doing that. And that's why I was so pleased to see this paper published just a few weeks ago. It was a meta-analysis of randomized controlled trials, and the authors concluded that despite their classification as phytoestrogens, the results of this analysis provide a strong rationale for not assuming that soy isoflavones will exert health effects similar to the hormone estrogen. So for this analysis, the authors looked at the effects of isoflavones on 4 endpoints that are affected by the hormone estrogen: endometrial thickness, vaginal maturation index, FSH levels, and estrogen levels. Isoflavones were without effect on any of those endpoints. Now, that's not to suggest that isoflavones can't have other effects in other endpoints or tissues that weren't examined, and in other subpopulations. That study only looked at postmenopausal women. Isoflavones have been hypothesized to reduce risk of breast and prostate cancer, improve the condition of the skin, improve the health of the arteries by looking at endothelial function, alleviate hot flashes in menopausal women, and to improve memory in older folks. Now, due to time constraints, I'll just talk about breast cancer and skin health. As you know, breast cancer rates differ markedly throughout the world. They're high in North America, Australia, and Europe, low in Africa and in Asia. And if we take a more granular look at the data, and these are incidence data for 1990, we see the rate in North America of breast cancer is about 3 times higher than the Japanese rate and about 7 times higher than the Chinese rate. But these kind of ecological comparisons are useful for generating hypotheses, but not for drawing any kind of meaningful conclusions. You can see rates in Central America and Middle Africa are very low. Not a lot of soy is consumed in those regions. And the question isn't whether Japan has a lower rate of breast cancer than the US. The question is, do women in Japan who regularly consume soy have a lower rate of breast cancer than women in Japan who infrequently consume soy? And the results of this meta-analysis of observational studies, epidemiologic studies, suggest that is in fact the case. The authors concluded that soy isoflavones are helpful in reducing risk of breast cancer. Now, my opinion, and one that I've held for 30 years, is that for soy to maximally reduce breast cancer risks, it needs to be consumed early in life. That's during childhood and/or adolescence. There's observational data in support of this hypothesis, animal data, and several mechanisms have been proposed to explain the chemopreventive effects of isoflavones when consumed early in life. I'm not ruling out the possibility that adult intake reduces breast cancer risk, but I'm more impressed with the hypothesis that early intake reduces risk. Now, despite the evidence indicating that soy reduces risk of developing breast cancer, one of the big controversies in this field, and it's been a controversy for 20 years, is whether soy is actually safe for breast cancer survivors, that the soy worsen the outcome of women with breast cancer. And you can see here from a survey that was conducted earlier this year, breast cancer is the #1 concern raised by clients of dietitians. And in fact, and this is surprising, it's only a 2-year comparison, but there were more concerns raised in 2023 than in 2022. Now, from a conceptual basis, it's easy to understand why there would be a concern. 2/3 of breast tumors are estrogen sensitive. These are, as you know, tumors whose growth is stimulated by the hormone estrogen. Isoflavones are classified as phytoestrogens, but as I've highlighted, isoflavones are different from the hormone estrogen. From an experimental standpoint, almost all of the concern was based on research in athymic ovariectomized mice. These are animals whose immune system has been inactivated, so the cancer cells can be implanted into the animals, and the ovaries have been removed to stop estrogen production so they can serve as a model for postmenopausal women. So is soy safe for breast cancer survivors? Well, I want to acknowledge that we don't have definitive data to resolve or address this controversy because no randomized trial has been conducted in which half of the breast cancer patients enrolled were given soy and half a control food, control protein, and then rates of recurrence and breast cancer specific mortality were looked at after a multi-year period. So we don't have definitive data. We don't have a definitive randomized controlled trial, but we do have lots of data. So we have, and what I'm going to be presenting is the epidemiologic data and specifically the prospective cohort studies, because these are the studies that carry the most weight within the epidemiologic community. And then, of course, the randomized controlled trials. So I mentioned we don't have a definitive RCT to address this controversy, but we do have quite a few trials that evaluated the effects of soy and isoflavones on markers of breast cancer risk. So for example, breast tissue density, which you measure using a mammogram, is a marker of breast cancer risk because breasts that are more dense are more likely to develop tumors. And even more importantly, a better marker is cell proliferation. Now, this is a more invasive procedure. You have to take a biopsy of the breast, but cells that replicate more quickly have less time to repair DNA damage, and our DNA is always being damaged. We have repair mechanisms in place, but if they're replicating more quickly, you have less time to repair that damage, so the cells are more likely to be transformed into cancer cells. So the breast cancer drugs tamoxifen and the aromatase inhibitor letrozole decrease tissue density and breast cell proliferation, and obviously they're used in the management of breast cancer. Conversely, combined hormone therapy, that's estrogen plus a progestin, increases breast tissue density and breast cell proliferation. Within just 12 weeks, breast cell proliferation increases 4 to 10-fold in response to conventional hormone therapy. And we know that conventional hormone therapy increases breast cancer risk. Now, in contrast to the beneficial effects of the breast cancer drugs and the harmful effects of combined hormone therapy, the clinical studies show without any inconsistency that neither soy or isoflavones, if given in supplement form, affect breast tissue density. 14 studies are breast cell proliferation.
Can you go back to the previous slide?
Pardon?
Can you go back to the previous slide? It said estrogen. Did it make a differentiation between what form of estrogen was given?
I think it was estradiol, but in my opinion, and I'm not an expert here, it's actually, in my opinion, it's the progesterone that increases cell proliferation and increases breast cancer risk. Because if you look at the
It's not progesterone here. This is medroxyprogesterone?
Yes.
Okay, there's a difference, yeah.
Yes, and because if you look at the Women's Health Initiative trials, estrogen alone didn't, I know there were differences between the women. One group was hysterectomy, was without a uterus, but it looks like it's the progesterone component that causes the problem.
Yeah, synthetic progestin and synthetic estrogens.
Okay, yeah. I'll defer to your expertise gladly. Okay. So in contrast to the harmful effects of the hormone therapy and beneficial effects of drugs, soy and isoflavones are without effect on these markers. So that's I think it's a very strong argument for the safety of soy. And these studies involved healthy women, women at increased risk of breast cancer, and women with breast cancer. And I want to point out that if you look at the right column and the yellow highlighted rows or cells, you can see that the isoflavone intake in these studies was huge, 100, 120, 103, 235 milligrams per day. And average intake in Japan is 30 to 50 milligrams per day. So this is at the highest. Very few individuals in Japan or China, such as Shanghai, would consume even 100 milligrams. Nobody is consuming more than 100, and you're still seeing isoflavones without any harmful effect. Now, the clinical data are supportive of safety, but the observational data are suggestive of benefit. So really the view on soy and breast cancer started to do a 180 in 2009 with the publication of the Shanghai Breast Cancer Survival Study. They found soy food consumption was significantly associated with decreased risk of death and recurrence in women with breast cancer. This is post-diagnosis soy intake in Shanghai. So it was a huge study, 5,000 women with breast cancer. Diet was assessed 4 times during the 4-year follow-up period, and on average. And during that follow-up period, there were 444 deaths, 534 recurrences or breast cancer-related deaths. Then a meta-analysis published last year of prospective observational studies found soy isoflavones were associated with a 26% reduced risk of recurrence, particularly among postmenopausal and ER-positive survivors. And it's the postmenopausal women and ER-positive breast cancer patients who, in theory, are most susceptible to any estrogen-like effects of isoflavones. So given the clinical and especially the observational data, the American Cancer Society concluded in 2022, post-diagnosis soy isoflavone intake is associated with a lower risk of recurrence. And then the American Institute for Cancer Research identifies soy foods as one of 5 factors that may reduce the mortality of breast cancer patients, the other ones being fiber, physical activity, healthy eating overall, and a healthy BMI. So I think it's fair to say in many respects, we've gone from a situation in the 1990s where the rodent research suggested that post-diagnosis soy intake could be harmful to breast cancer survivors, to the situation today where the clinical data is supportive of safety and the observational data are suggestive of benefit. Skin wrinkling, natural phenomenon due to a variety of environmental, genetic, and hormonal influences. There have actually been 10 randomized controlled trials to look at the effects of isoflavones on skin health. But really, with the exception of the maybe 2 studies, but certainly with the exception of the study I'm going to show next, all of those trials had pretty significant design limitations or weaknesses. Maybe the isoflavones were combined with other bioactives, a lack of a true control group, some type of weakness that really prevents any kind of definitive conclusion from being made. But I do want to show you this one that was published last year. The authors found soy protein containing isoflavones improved skin photoaging, including wrinkles and dyspigmentation and increased skin hydration. So this was a 6-month intervention, fairly long. I'd like to see a little bit longer, maybe a year. Postmenopausal women, lighter skin types, Fitzpatrick skin types 1 through 3, parallel design, 30 grams per day of soy protein consumed by one group. The other group consumed 30 grams per day of casein, the main protein in milk, cow's milk, looked at wrinkle depth, pigment intensity, and hydration. So on the left, we see in the green bars, there was a 6.5% decrease in wrinkle severity in the soy group, no change in the casein group. The difference between the two was highly statistically significant. For pigment intensity, it's really referring to the blotchiness of the skin, 2.5% decrease in the soy group, no decrease in the casein group. The difference between the 2 groups was significant. For hydration, there was a significant increase in the left and right facial cheek in the isoflavone group when compared to baseline, and no change in the casein group. So I want to point out that 30 grams of soy protein is a fair amount of protein. Average soy protein intake in Japan is maybe 9 grams per day. But 50 milligrams of isoflavones is the amount provided by 2 servings of traditional Asian soy foods. So that could be 2 cups of soy milk, or really 7 or 8 ounces of tofu. So a fairly relatively easy amount to incorporate into the diet. Another controversy, and one that I've been personally and professionally interested in for a long time, is this notion that soy may feminize men. I eat soy on a regular basis, so I have a particular interest in this claim. If to address this feminization effect, and I can go into the background of how this concern arose, maybe during the question period, if there's interest. I want to look at the effect of soy on hormone levels, of course, testosterone, but also estrogen, because it's often not appreciated that older men actually make more estrogen than older women do. So I think it's important to look at both hormones. So here we have a meta-analysis of 41 randomized controlled trials. No effects of soy or isoflavones on total testosterone, but 1,700 men, free testosterone, biologically active form, estradiol or estrone. 3 studies have looked at the effects of, clinical studies looked at the effects of soy or isoflavones on sperm or semen parameters in healthy men. Now that last one at the bottom was just described in the proceedings. It wasn't published as a separate manuscript. But none of these intervention studies found any effect on sperm or semen parameters. But interestingly, in 2006, there was a case report, so single individual, of a man, a couple that entered a fertility clinic. It was determined that the man had oligospermia, low sperm count. He was given 80 milligrams of isoflavones per day for 3 months, and his sperm count normalized, and the couple was able to have a child. I didn't think very much of it. It was just one case report in 2006. Now, coincidentally, earlier this year, another case report was published, same exact situation, and also the dose of isoflavones, 80 milligrams per day, was given to the man.
Sorry, Mark, I was letting somebody in and I muted you.
Okay.
Sorry about that.
We okay now?
Yeah, good. Go ahead.
Okay. So anyway, I'm just saying that the second case report was published in just earlier this year. 80 milligrams of isoflavones also normalized sperm count in the man with low oligospermia. I don't know what to make of these data. I think they're pretty intriguing, but it's just 2 individuals reporting so far. Soy and thyroid function. This is an area that's been researched for almost 100 years. First study in animals was published in 1933. So I'll just go right to this meta-analysis, the only one conducted, published in 2019, 18 randomized controlled trials, no significant effects of soy or isoflavones on T4 or T3 levels. In 2017, the U.S. Food and Drug Administration conducted a complete safety review of soy. They evaluated all the relevant scientific literature. They also examined the 1,300 comments that were submitted by the public. Many of those were quite negative. They concluded that soy protein is safe. They rejected all safety concerns with the exception of soy protein allergy. And it's not surprising that soy foods cause allergic reactions in some individuals, because 200 foods have been shown to cause allergic reactions. But soy, in the United States, soy is one of the big 9. These are the 9 foods that are thought to be responsible for 90% of food allergic reactions among Americans. but the prevalence of allergy for each of these big nine differs quite dramatically. And soy has the lowest prevalence except for sesame, which was added 2 years ago. Estimated prevalence based on surveys in US and Canada is about 3 adults out of every 1,000. Clinical evidence suggests that 70% of children outgrow their soy allergy by age 10, although you can actually develop a soy allergy during adulthood. And highly refined soybean oil is not allergenic because there's not enough soy protein in highly refined soybean oil to elicit an allergic reaction. And I think it's worth pointing out that the FAO did not include soybeans on their list in their global priority allergen list because of its low global prevalence, low allergenic potency, and low severity of symptoms. The global priority allergen list are cereals, gluten, shellfish, eggs, fish, milk, peanuts, sesame, and tree nuts. I don't know if you want to stop for a moment and take a question, or I'm fine going on, whatever you want to do.
Yeah, I have a question. How do we know, and I put these in the chat, how do we know that soybeans are GMO free, free from glyphosate? Are Japanese soybeans healthier than US soybeans?
Are they what? Are they what?
Are they healthier, safer
Oh.
than US soybeans? Are you going to talk about miso? And then, we have soy cheese, different types of products. And, that's a good place to start.
Yeah. Thanks for your questions. Let me do those at the end because I do talk a little bit about genetic modification, and I think it'd be more appropriate at that time. We'll talk about miso, whatever you want to talk about.
Okay.
Okay, thank you. So if there's nothing else, I'll just go on, talk about ultra-processed foods. This is, probably the hottest topic in the field of nutrition. Tons of articles written in the for the public as well as the scientific literature. In fact, there's about 600, more than 600 this year. I think we're up to about 650 so far. About 600 articles on ultra-processed foods are indexed in PubMed annually now. That's a fourfold increase since 2019. You see lots and lots of stuff online about the dangers of ultra-processed foods, and some politicians are now talking about ultra-processed foods. And you see a lot of articles, podcasts, helping people learn how to avoid or eliminate ultra-processed foods from their diet. And I think this information is having an impact because in a survey published just a couple of months ago, 41% of the US adults that responded indicated that they're trying to avoid or eliminate completely ultra-processed food from their diet. That's going to be pretty darn difficult to do, probably impossible, because we get 57% of our caloric intake from ultra-processed foods, and 73% of all foods in the marketplace in this country are thought to be ultra-processed. Well, why the concern? It's because the epidemiologic literature consistently shows that ultra-processed food intake is associated with a wide range of adverse health outcomes. I mean, everything from certain cancers, dementia, obesity, frailty, on and on and on, IBS, just about everything you can think of is associated with ultra-processed food intake. This slide just lists 6 umbrella reviews of meta-analyses published just this year. It's really quite phenomenal. So one question you might be thinking, why am I talking about ultra-processed foods? And I'm talking about ultra-processed foods because the entire new generation of plant-based meat alternatives, these are plant-based meat alternatives made using a concentrated source of protein, whether it's soy, pea, or wheat, are classified as ultra-processed foods. 90% of all plant milks are classified as ultra-processed foods, including soy milk made from whole soybeans. So what are ultra-processed foods? Well, my personal opinion is that nowadays when people mention ultra-processed foods, it's really just a generic term for junk foods. I'll explain the coinage of the term ultra-processed foods, but I think people are using them now just to refer to unhealthy foods. In fact, if you do a Google search using the term ultra-processed foods, junk foods, and processed foods, this image comes up on all three foods. But the term ultra-processed food is actually coined by Brazilian researchers in 2009 when they created the NOVA food classification system. And there are a lot of nutrient profiling models, food classification systems used around the world. Nutri-Score, Health Star Rating, Food Compass is a new addition created by Tufts University. But NOVA is unique because it classifies all foods into one of four categories based entirely on the extent to which that food has been processed. So you have the group 1 foods, which are foods in their natural state, easy to understand, fruits, vegetables, nuts, grain, legumes, meat, milk. The processed culinary ingredients, group 2, the oils, fats, butter, vinegar, sugar, and salt. And processed foods are often a combination of group 1 and group 2 foods. And then the ultra-processed foods, which is what we really care about for the purposes of this discussion. And one way to think about ultra-processed foods is that they're made with non-home ingredients. So if you couldn't make that ingredient on your own, or you really couldn't buy it, it's going to be an ultra-processed food. So any flavoring, artificial sweetener, anything that really you couldn't make on your own makes that food ultra-processed if it contains it. The foods are often really high in fat, sugar, and salt, but that's not a prerequisite for classification as an ultra-processed food because it's based on processing. Now, I have a very low opinion of this classification system, and this slide is one example of why I do. Because if you take fruit and mix it to make a smoothie with cow's milk, those two foods are group 1 food, and you end up with a group 1 food, which is unprocessed or a minimally processed food. However, if you add a concentrated source of protein to it, you end up with an ultra-processed food. And I think most nutritionists would prefer that you add protein to your smoothie than not, and yet that would become an ultra-processed food. So to me, this makes no sense. Plain yogurt is a group 1 food, foods to be encouraged in the diet. Flavored yogurt becomes an ultra-processed food. And if a picture is worth 1,000 words, then maybe this next slide is worth 4,000. Because regardless of what you think about tofu, soy milk, or soy burgers, they are different from Twinkies nutritionally. And yet the soy products are classified as ultra-processed foods, which puts them in the same category as Twinkies. And to me, that doesn't make any sense. And we have a really good recent clinical example of the weaknesses of the NOVA food classification system. So this is a meta-analysis of randomized controlled trials comparing the health effects of soy milk group 4 food with cow's milk group 1 food. So again, 17 trials in this meta-analysis, RCTs, median duration was 4 weeks, a relatively short term. The investigators looked at 19 intermediate outcomes, their cardiometabolic health, mostly lipids, glucose, blood pressure. Average intake of the milks was about 500 ml. And just a very simple presentation, in comparison to cow's milk, soy milk lowered LDL cholesterol 6%, it increased HDL 4%, a modest amount, but it was significant. Decreased blood pressure 8 millimeters, which is huge. I have some concerns about the likelihood about that finding, but that's what they found. Diastolic was decreased by 5 millimeters, significant, and CRP, a general marker of inflammation, was decreased by about 22%, also significant. So I think NOVA paints with a very, very broad brush. And I think it is insufficiently nuanced to serve as a consumer guide for food purchasing decisions. Another huge controversy is seed oils. I suspect all of you are familiar with this controversy, and it's interesting because it's pretty much just internet-based. Normally, like for the breast cancer, even feminization, there's at least data in the scientific literature to make the case that soy could worsen the prognosis of breast cancer patients, or that soy may feminize men. Could be animal studies, could be just low quality studies. Seed oils, it's difficult to point to any significant body of literature to justify this kind of concern. Again, you see a lot of scary articles about seed oils. You go online, podcasts, interviews, harmful effects of seed oils. You could just have many, many slides talking about the dangers of seed oils. So seed oils are oils produced from seeds as opposed to fruits, and they are often referred to as the hateful eight: canola, corn, cottonseed, soy, sunflower, safflower, grapeseed, and rice bran. And there's a small but incredibly vocal, and I would say growing, anti-seed oil movement. So why the hate for seed oils? I think this slide lists the main concerns raised about these oils by the folks that think they are harmful, that they're a modern addition to the diet, that they're highly processed, that they have a high ratio of omega-6 to omega-3 fatty acids, that linoleic acid causes inflammation, and that linoleic acid causes oxidative stress. So just for the sake of argument, I'll readily acknowledge that these oils are a modern addition to the diet. They really only began to make a contribution to the diet in the United States in the 1960s with the emergence of soybean oil. And although it's a subjective sort of evaluation, I would say it takes a fair amount of processing to go from the seed to the oil that you would purchase at the grocery store. What about this notion that they have a high ratio of omega-6 to omega-3 fatty acids? Well, just as a refresher reminder, linoleic acid, essential fatty acid, is an omega-6 fatty acid because the first carbon-carbon double bond occurs at carbon-6 from the methyl end. 90% of the polyunsaturated fat in our diet is in the form of linoleic acid. And then alpha-linolenic acid is an omega-3 fatty acid because the first double bond occurs at carbon-3 from the methyl end. This is also an essential fatty acid, and alpha-linolenic acid accounts for the vast majority of omega-3 fatty acids in our diet. And it's absolutely the case, I'm not showing the ratio here, but these seed oils, with only really one major exception, are very high in linoleic acid. For 6 out of the 8, more than 50% of their fat is comprised of linoleic acid. Canola oil is really an exception here. So you may wonder why this is vilified. Well, it's higher in linoleic acid than palm oil and olive oil, 2 oils that the anti-seed oil folks would prefer that you consume over any of the seed oils. So these oils do have a high ratio of omega-6 to omega-3 fatty acids, but I consider that ratio to be completely irrelevant. When I was going to school, it was the consensus that you wanted to have a relatively low ratio of omega-6 to omega-3, and it was thought that perhaps Paleolithic man consumed the diet that was maybe 2 to 1. Some people were even recommending a 1-to-1 ratio. Our ratio is 10 to 1 right now. But here's just a partial list of organizations that have concluded that the omega-6 to omega-3 ratio is either uninformative, that is, it's not a metric of diet quality, or make no statement about its utility for that reason, because it's not a good metric of diet quality. So I think this is completely irrelevant. What about the notion that linoleic acid causes inflammation? that concern has been refuted clinically time and time again. Here we have the result of meta-analyses of randomized control trials published first in 2012, then 2017, and then 2021, show that randomized control trials show that linoleic acid does not affect markers of inflammation. Just really quickly, I don't have a slide to show this, but the concern was that linoleic acid would be converted in your body to arachidonic acid, which is another omega-6 fatty acid. And from arachidonic acid, you would produce metabolites that cause inflammation. We now know that linoleic acid doesn't really affect tissue or blood levels of arachidonic acid. And also, some of the metabolites of arachidonic acid have anti-inflammatory properties. And then finally, what about the notion that linoleic acid causes oxidative stress? Well, in one sense, there's some truth to this concern because the double susceptible to oxidation. So that's why you need to store these seed oils in a dark location, away from light, away from heat, and keep the lid tightly closed and by amounts likely to be consumed within months. And sometimes it concerns me when I go to the big box stores and I see people buying huge amounts of vegetable oil or seed oils. If they're not doing it for using those for a retail establishment, those oils are probably going to be kept for a really long time if it's for home use. That could raise some concerns. But as Martha Belluri stated in a podcast a couple of years ago, we are not a bottle of vegetable oil, meaning that the human body is equipped with a variety of antioxidants, both enzymatic and non-enzymatic mechanisms to counter the effect of oxidants. And here's just a review from 2019 in which the author concluded there's no evidence that higher intakes of linoleic acid increase lipid peroxidation or increase LDL oxidation in vivo. Now, I do want to make it clear that there's a lot more data, clinical data, showing that linoleic acid and the seed oils do not increase inflammation. I showed those 3 meta-analyses in comparison to the amount of work that has looked at the effects of linoleic acid on markers of oxidative stress. What does exist is pretty supportive of safety and not having oxidative effects, but I think we need some more data. So I think this argument against seed oils does not really hold water. How much linoleic acid should we consume? Well, that depending on who you talk to, that's going to estimates or recommendations are going to vary quite dramatically. Currently, the American Heart Association recommends consuming 5 to 10% of calories in the form of linoleic acid. How much does the US consume? Here we have some data from N. Haynes over an almost 20-year period, 3 different time periods, about 5,000 individuals in each survey. So first you see that we get about 11 to 12% of our calories from saturated fat. The recommendation is to consume no more than 10% of your calories from saturated fat. So as a nation, the US has never met that recommendation. We get about 7.5%, 8% of our polyunsaturated fat from of our calories from polyunsaturated fat. And again, 90% of the PUFA is linoleic acid. So we're actually right in the middle of the range recommended by the American Heart Association. In the end, you can hypothesize, speculate about what effect linoleic acid has and seed oils have on intermediary markers. You can look at CRP for inflammation and LDL oxidation or MDA for oxidative impact on oxidative stress. But in the end, what really matters is what impact consuming linoleic acid and seed oils have on clinically relevant outcomes. So I'll just turn to this huge review that was published on behalf of the Nordic Nutrition Recommendations. It was published earlier this year. The authors conducted 2 systematic reviews of their own. They examined 21 systematic reviews and 70 meta-analysis and biomarker papers. And they found partial replacement of saturated fat with omega-6 polyunsaturated fat improves blood lipids, decreases CVD risk, improves glucose insulin homeostasis, may decrease overall mortality. Both omega-6 and omega-3 PUFA may be associated with lower risk of type 2 diabetes, and biomarkers of omega-6 PUFA are associated with lower cancer mortality. And if you want one good sort of reference for information on linoleic acid and seed oils, I would recommend this paper. It's open access, so anybody can download it without cost. And then finally, just a word about genetic modification. This is not an area that I'm well versed on. Genetically modified or engineered crops have been grown in 24 countries. They've been available since the 1990s. Genetically modified foods are evaluated in this country by the USDA, Food and Drug Administration, and the Environmental Protection Agency. In 2020, and I suspect the figures are even higher now, 94% of all soybeans were genetically modified, 96% of all cotton was genetically modified, and 92% of all corn. You can see that soybeans were approved, genetically modified soybeans were approved in 1996. And the genetically modified soybeans have an enzyme that is not sensitive to the inhibitory effects of glyphosate on the enzyme that is responsible for synthesizing the aromatic amino acids phenylalanine, tyrosine, and tryptophan. So if you can't make those amino acids, the plant or the weed is going to die. The soybeans don't die because they have another enzyme implanted in them that is not susceptible to glyphosate. And I'll just cite the current position of the Environmental Protection Agency, or underlying scientific findings regarding glyphosate, including the finding that glyphosate is not likely to be carcinogenic to humans, remain the same. So they consider genetically modified soybeans to be safe. Obviously, there is a controversy about glyphosate, but the agencies in this country consider it to be safe. From my perspective, I can say with quite a bit of certainty that the nutrient composition of genetically modified soybeans is essentially identical or similar to non-genetically modified soybeans. And for those of you who have concerns about either glyphosate or genetic modification for beans for other reasons, I'll say that in the United States, nearly all of the tofu and soy milk comes from non-genetically modified soybeans. So there are plenty of options if you are concerned about genetically modified beans. And just as a last slide, as a general intake recommendation, for adults, I would say about 2 servings per day. That's going to provide about 50 milligrams of isoflavones. In the epidemiologic studies and clinical studies that show benefits of soy consumption, 2 servings, 50 milligrams of isoflavones is generally, it meets the efficacious threshold. It's also going to provide anywhere from 15 to 25 grams of soy protein. I would say for an upper limit, I wouldn't want to go more than 4 servings per day because, not because there's evidence that beyond that amount is harmful, because there are clinical studies that have gone for long periods of time that have fed subjects larger amounts than 4 servings without showing harm. It's just that if you're consuming more than 4 servings per day, first of all, it means that you're putting way too much emphasis on one food. And second, if you're consuming 4 servings per day, you're probably going to be getting at least, 30 or 40 grams of protein per day from soy. And I think your nutrients come from a variety of different sources. You don't want 50% of your protein coming from one source. So thank you very much for your attention.
Yeah, I think this is a nice presentation, but there's a lot of confounding factors that does not allow us to make sense of everything. And one of the confounding factors for me is that we're talking about the isolate, which is the isoflavones, and also the soy protein that people are consuming. So for instance, if somebody eats tofu, it will contain some isoflavone, but it may not contain much. It may be just of a soy protein that has been genetically modified by, say, glyphosate. Uh, how can we compare those two, isoflavone versus the soy protein itself that people are consuming? And
Yes,
also compare that with the soy oils, and that is a highly processed. I mean, how can we disentangle all of that?
it's actually easy. So soy oil just is fatty acids, some vitamin E, vitamin K, but it doesn't contain any protein, doesn't contain any isoflavones. So if you're looking to alleviate hot flashes, you're not going to want to consume soy oil. So I think that's pretty clear cut. The absorption of isoflavones from food is similar to the absorption of isoflavones from supplements and from soy protein. So in most of the clinical trials, the supplements have been used, the isoflavone supplements in pill form, or the powder in the form of soy protein that contains isoflavones have been used because, first of all, ideally you want to blind the subjects. And of course, you can give an isoflavone pill and a placebo pill. They're not going to know in which group they are. You can give a soy protein powder versus a casein powder. They're not going to know what group they're in. If you give them tofu, it's going to be hard to come up with an appropriate control that would still keep the subjects blinded. Also, it's harder to standardize tofu versus a pill or the powder. And then finally, if you're looking at an intervention study in the United States or in outside of Asia, compliance becomes an issue. If you're asking folks to consume 2 servings of tofu every day for 6 months, I think over time compliance is going to be a big issue. So I think it's fairly clear cut. Now, when you consume tofu, you're getting omega-3 fatty acids, and you're getting the protein. When you consume the isoflavones, you're in supplement form, you're just getting the isoflavones. So for cholesterol reduction, the health claim is for 25 grams of protein. It's the protein that lowers cholesterol. I don't think isoflavones have any effect on cholesterol. When you consume the food, if you're consuming edamame, you might get some resistant starch, some fiber, isoflavones, some protein, omega-3 fatty acids. And also, hopefully, you're displacing less healthy foods from the diet. So there's no question in my mind that the first approach to get soy into your diet should be from soy foods. Now, if you are a postmenopausal woman and you're having 10 hot flashes per day, and for whatever reason you don't want to take hormone therapy, and you want to try some alternative therapy, and you think isoflavones may work, but you don't want to consume 2 cups of soy milk per day, then sure, you can maybe take two pills or a pill and 1 cup of soy milk.
Yeah, okay. So for instance, the Shanghai study, I suppose they used the soy from Asia. They're not using the soy from the United States. As you said, probably 94% of the soy grown in this country is a GMO, genetically modified. Even though the EPA is saying that the glyphosate has no effect on the soy protein itself, I doubt that's the case because they haven't done all the studies at the molecular level when we have all the pesticides and herbicides and fungicides and everything else that we're putting in this protein that can affect the human body. Now, many people who talk about gynecomastia in men by consuming soy protein or breast cancer by consuming soy protein, they're alluding to these contaminations and everything else that is driving those conditions. Not
Okay,
just
can I stop you right there, just so I don't forget?
Yes.
I don't mean to be rude, but so gynecomastia, there were the concern about soy feminizing men
Right.
actually was caused primarily or based primarily on a 2008 case report where an individual consuming soy developed feminizing effects, including gynecomastia. And since 2008, there have been 2 other case reports showing feminizing effects. In each case, well, the first 2 cases, the men were consuming 360 milligrams per day of isoflavones. In one case, it was a 60-year-old man who was consuming 12 cups of soy milk per day. In the second case, there was a 19-year-old vegan who was consuming about 20 servings of soy per day. So 360 milligrams of isoflavones is about 9 times higher than average intake is among men in Japan consuming a traditional diet. 2 clinical trials, long-term clinical trials, have actually looked at the impact of soy on breast tissue, seen absolutely no effects. For the Shanghai study, that's a free living population. They were consuming primarily tofu, secondary soy milk. That's how they received their isoflavones. I think that if soy, in fact, improves the prognosis of breast cancer patients, it's due to an isoflavone effect, because you see some things happening with when you just use the individual isoflavones. I won't debate you on obviously you think that the herbicide glyphosate is harmful. I'm not gonna debate you on that topic. I just don't have the background to do that. The clinical studies in this country that have used soy protein isolate are come from genetically modified soybeans. So they take the bean, they get rid of the fiber, carbohydrate, and fat, leaving you with the protein. And there have been probably 300 or 400 clinical studies that have intervened with soy protein isolate made from genetically modified soybeans. And those, I can say those studies are not showing any harmful effects. Some of them have gone out for 2 and 3 years in duration, not longer than that. That's a fairly long time for a nutrition study.
Well, thank you for the answer. I will let other people intervene.
Okay. In the chat, there is you did answer the question about meso products, correct, Mark?
No, I didn't. I would interested in knowing, it's a fermented product. There are some in the epidemiologic studies, miso, especially from Japan primarily, where it's a popular food. So in Japan, they get about half of their soy from tofu and half from natto and miso, 2 fermented products. Natto may have some interesting advantages, benefits over the other soy foods. Miso doesn't show up as well in the observational studies in terms of reducing cancer risk, maybe benefits for heart disease. So the isoflavones are still present. You hydrolyze the fermentation results. So let me back up. The isoflavones are present in soybeans, in unfermented soy foods, with a glucose molecule attached. So they're glycosides. In order to absorb these isoflavones from soy foods and soybeans, unfermented soy foods, you have to hydrolyze the glucose molecule. Pretty easy to do. In fermented foods, to varying degrees, the isoflavones are without the sugar because fermentation hydrolyzes the sugar off. That may cause the isoflavones to be more quickly absorbed. And there is a school of thought that says if you can absorb the isoflavones faster, even if total absorption is not increased, because they're absorbed more quickly, Cmax levels in your blood may be increased, and that may be an advantage. But I think the key to me is to identify a couple soy foods. If you're interested in getting isoflavones or protein, just identify a couple soy foods that you like. And that's how you can incorporate soy into your diet. Miso tends to be really high in sodium, so that is an additional consideration, as do a lot of the plant burgers, by the way.
Are U.S. soybeans sprayed with glyphosate?
Yeah, you bet. Well, 94 or 5% probably are. Now, bear in mind that almost all of the soybeans are used for animal feed.
Mhm.
So 90+% of the animals of the soybeans grown in the US, there's like 550,000 farmers, soybean farmers in the US. We're the number 2 producer, Brazil's number 1, Argentina, I think, might be 3, and then perhaps China. So in the US, probably 95% of all soybeans are genetically modified. They are sprayed with that herbicide.
Okay.
But again, those are used mostly for animal feed.
All right. So Dr. Stein asks, where are soybeans grown in the U.S.?
Midwest, the big ones are Indiana, Ohio, Illinois, Iowa. And because different varieties of soybeans have been grown, have been developed, you can grow them in North Dakota, you can grow them in Arkansas. So a wide range, but the Midwest is the big area.
Okay. All right. The idea that heart disease and cancers and illnesses all increase since the use of seed oils, is that sort of a myth, or is that a fact?
That's a fact. It's also cancers increase with the number of television stations, the number of podcasts. I mean, that kind of correlation. You can the growth in organic food correlates with the rates of autism. I mean, those kind of correlations are interesting, and sometimes they can form the basis for a hypothesis. And then you look at more robust kinds of experimental design. So you what you want to look at is, because that's group data. It's not talking about what any individual is doing. So you look at the prospective studies that are now going on for decades, and you look to see, do people in those countries who consume higher amounts of seed oils have more or less cancer risk, heart disease risk, diabetes? And when you look at, they have lower risk of those chronic diseases.
Okay.
I have a quick question. So
Yeah.
the isoflavones you said are not estrogen.
Well,
but
no.
Do they use estrogen receptors though?
Yes. So I didn't say they were not estrogens. I say they're different from the hormone estrogen. So they bind to estrogen receptors. They preferentially bind to estrogen receptor beta, which is thought to have an anti-proliferative effect when activated, whereas estrogen binding or activation of estrogen receptor alpha has a proliferative effect. So we've known about estrogen receptor alpha for decades. Estrogen receptor beta was 1996. And then 2 years later, it was shown that isoflavones prefer that hormone versus estrogen receptor alpha. But I would say that it's best to look at the clinical data rather than speculating about what isoflavones will do based on understanding of their molecular action. So one of the neat things, it was brought up at the beginning that isoflavones are seen as endocrine disruptors. So I had co-authored a paper with 9 other authors that was, I think it was 30,000 words, 700 references. And we looked at this, whether soy or isoflavones warranted classification as an endocrine disruptor. We included they didn't. But one of the advantages is that if you're looking at like BPA, this is in plastic, as an endocrine disruptor, you can't actually feed BPA to humans. So for tox studies, you're going to use animal. Maybe you can look up some epi data, but there are hundreds of clinical studies in which groups of individuals have been fed or consumed soy protein containing isoflavones, or in some cases, soy foods and isoflavone pills. So we have a wealth of data upon which to evaluate whether these isoflavones have harmful effects, whether they have estrogen-like effects. And so one of the early theories when I first entered the field was that they would act like anti-estrogens because they would bind to the receptor and block the more potent estrogen from binding. So that would be useful if you were a premenopausal woman, and then they would function as estrogens if you were a postmenopausal woman. Well, you can count on one finger the number of studies that show in vivo clinical studies that show anti-estrogenic effects of isoflavones. I mean, so fortunately, we just have this wealth of clinical data upon which we can reach conclusions about their health effects.
It would be nice to know the meta-analysis that have been done by country. Is it the meta-analysis of the studies are done in the US, are they done in Japan, are they done in China, etc., and then compare to see what the findings are? I think that would be very enlightening.
So they do that. So of course, most of the intervention studies have been conducted in the US and Europe. It's hard to do intervention studies in Japan because background soy intake is so high. So, if you wanted to look at the effects of consuming 2 servings of tofu, you would either have to find people that didn't consume soy as part of their usual diet or ask them to stop consuming soy for the intervention period, which would maybe be difficult for some people to do. But is your suggestion that you would want to look at intervention studies that used genetically modified beans versus non-genetically modified? Yeah. The intervention studies, I mean, a lot of the studies have used the isoflavone pills. So you're really just getting isoflavones in those pills. I don't think, and again, we have most of the isolates used around the world in intervention studies are going to come from genetically modified soybeans. And the group that I work for right now is developing a database where we can look at where the studies were conducted. So if you want to email me privately, I can get you some of that information and look at how many studies were conducted in the US, Canada, and how they were funded, who funded the studies. So I can get you that.
Thank you so much. That's good. Thank you.
Dr. Nario, you have some email questions?
Yeah, so I guess there's a question here. So where did the bad rap of soy really come from? Is it from being GMO based or the contamination of glyphosate?
Neither one. It was animal studies. So most concerns, so I'm not just talking about soy nut seed oils, you can trace, so I mentioned for feminization, it was a case report where a man developed gynecomastia and other symptoms of feminization in response to soy consumption, but it was 12 cups of soy milk per day. And in some animal studies, there was a small drop in testosterone levels in the animal studies, but animals metabolize isoflavones differently. But you first do the animal studies before you get to human studies, generally speaking. For breast cancer, the first study showing that isoflavones stimulated the growth of existing mammary tumors, ER-positive mammary tumors in mice, was published in 1998. That laboratory then published a paper every 2 years, slightly tweaking that model, showing that isoflavones inhibited the efficacy of aromatase inhibitors, inhibited the efficacy of tamoxifen. So there's usually a basis for the concerns being raised. It wasn't for another decade that the observational studies showed that soy consumption benefited women with breast cancer. And then during that time, a lot of clinical studies were showing no adverse effects of soy on any outcomes. For thyroid, again, it was animal studies showing that soy inhibited or isoflavones inhibited the activity of an enzyme required for the synthesis of thyroid hormones. So that was in animals in beginning in 1996 or 2002. But then you start doing the clinical studies and you're not seeing any of these effects. So it's really animal studies.
That started the bad reputation for soy.
And a few case reports. And then also, and I'm sure you recognize this because it's got to be true in the medical literature, just like the nutrition literature, but probably more so in nutrition, because our clinical studies are tend to be small in size because compliance is an issue. The funding isn't available for nutrition studies like it is for drug studies. So you have a bunch of small studies, and just by chance, you're going to get outliers. So you do a clinical study, you find some weird result, and maybe the next person tends to confirm that. You have a hypothesis, and then you do studies that follow up and follow up and follow up, and then you see what the totality of the evidence looks like. And it takes a long time to refute some concerns once they're in the minds of the public. And we're still fighting that battle.
So if you're pertaining to the fact that it's the amount of consumption of soy that will be bringing in the deleterious effects of it, are the vegans and vegetarians now in danger of risking themselves for these bad effects of huge amounts of soy intake?
Yeah, not even close. First of all, I'm a vegan. My wife's a vegan. She's the vegan RD. Soy consumption is much, much less than you would imagine. It's probably maybe 20 milligrams per day, which is, not even close to the 100 milligrams, which is the upper limit that I would recommend.
Okay. This is a question from I guess your slide about the muscle building potential of soy versus animal meat. It's asking that should we eat more soy to match the capacity of an animal meat protein? Or you're saying that slide was head to head, 1:1.
Yeah, it was equal amounts of animal, equal amounts of soy protein. But first of all, it's resistance exercise. That's the key. Total protein plays a minor role, and protein type plays even a lesser role than that. And if you think about, this is a paper that I just read, which I thought was very thought-provoking. If you're trying to see minor effects, like is one type of protein more effective than another type of protein, and even if it is, the effect is going to be modest, you need a really large sample size to see a statistically significant difference. I don't think it's really worth being concerned about in terms of which protein you should consume. Just make sure you get enough. But the point is that soy protein can serve, or soy foods can serve as a source of protein for those who do want to build muscle. There's studies showing it. There's a Chinese study, a really beautiful study. They had individuals real quickly with sarcopenia, and they were consuming more than the RDA for protein, about 1 gram per kilogram body weight. They were given continued to consume the habitual diet. One consumed a mix of soy and whey protein, 16 grams. Another one consumed just whey. The other one consumed just soy. All three groups dramatically improved muscle mass and performance in these individuals.
And I think this is something also done by Dr. Sivamani, and I'm sure you met him in the integrative dermatologic symposium where I met you guys. And he also vouches that plant proteins can be a head-to-head matchup with animal proteins in muscle building. And this is, again, we're done with, I think, more of bodybuilders that he had studied on. So, but yeah, I've heard of this literature before, and this is definitely something interesting. Another one is, I think it's pertaining to your slide. If it doesn't affect the testosterone levels for men, what accounts for the increase in sperm count that you just mentioned?
Yeah, so excellent question. And all I can say is that I don't actually know. I'll have to look at this. I'll have to look at what happened to testosterone levels in those two case reports. But so I mentioned that in the 3 clinical trials, there were no effect on sperm or semen parameters, but all 3 clinical trials involved healthy individuals. And these folks came into the clinic, with low sperm count. Now, I don't know I'll ask you, it's outside my area. If they had low testosterone and you increased it, would that possibly account for the increase in sperm concentration or count?
That is possible, but spermatogenesis happens in the Sertoli cells, and Leydig cells are the ones testosterone.
You need to stimulate.
Go ahead.
You need to stimulate FSH in the pituitary
Right.
to increase sperm count. So
okay, I'll look at that.
Okay, so
it's a case report, so I don't know how much work they did, but
Right.
on the folks. But
so
that's
there's a difference between luteinizing hormone, which increases total testosterone, and follicular stimulating hormone, which stimulates the Sertoli cells to produce sperm. So
Okay, thank you.
Right. There's a part of your slide that there was an arrow between genistein, arodeitsin, aroglycetin. What does that mean?
It connotes or denotes concentration. So genistein is present. Genistein accounts for about 50% of the total isoflavone content. Daidzein about 40%, and then glycetine about 10%. Now, interestingly, back in the 90s, when supplements first started to become popular and be used clinically, the first supplements that became available actually had very high amounts of glycetine, which is the isoflavone that's present in only 10% of the soybean. It's because of the way they made the supplement. And a lot of those studies showed that those supplements were ineffective. So I was involved with the meta-analysis in 2012 that looked at the effects of isoflavones on hot flash alleviation. And when you divided the supplement into the kind that had the isoflavone profile in soybeans, high genistein, versus the ones that were low in genistein, it was only the high genistein supplements that were actually efficacious.
So what was the amount of isoflavones, meaning genistein has the most and then goes down?
No. So if you take 40 milligrams, so if you take 50 milligrams of isoflavones from soybeans, about 25 is going to be genistein, and about 20 or so is going to be daidzein, and 5 is going to be glycetine. That's the normal ratio in soybeans. But there was a way to make a supplement mechanically that would end up giving you a whole bunch of glycetine and very little genistein. That supplement was shown not to be very efficacious.
Okay. I think that was more of a clarification than a question, because they were wondering what that sequence was.
I
have
a question about genistein here in the chat, so maybe we can follow up on that. So can you comment on genistein as an anti-cancer agent?
Yeah, so I got into the soy field in '89 because I was working at the National Cancer Institute in the Diet and Cancer branch, and long story short is that some now colleagues of mine presented some research showing that soybeans inhibited the development of mammary cancer in rats. The head of the National Cancer Institute wrote the branch I was working in and asked if we were doing anything with soy. The secretary saw the note, and she said, "You eat tofu, why don't you do something?" So that's how I started my career. And it was really, the focus was on genistein, because they found that genistein inhibited enzymes that are overexpressed in cancer cells. So back in the 90s, there was a lot of interest in the anti-cancer potential of genistein, independent of its interaction with estrogen receptors. They thought it was inhibiting tyrosine protein kinase and a couple of other enzymes. But the concentration required to inhibit those enzymes in vitro could never be achieved by consuming supplements or soy foods. So I think there was some unjustified excitement about soy and cancer prevention, but there's still a lot of interest in using genistein as an chemopreventive agent, as a drug, where you can give much higher concentrations. Now, it's possible. I mentioned that isoflavones. I think consuming isoflavones early in life, when you're a child, adolescent, reduces breast cancer risk. I think that's a genistein effect, and I think there's some proposed mechanisms. One is that it increases concentration of estrogen receptor beta. So, I mean, there's a lot of hypotheses, but it's really, unfortunately, it's very difficult to show with confidence diet cancer relationships, because you have LDL cholesterol and blood pressure as great markers of heart disease risk and maybe bone mineral density for osteoporosis and bone health. You don't have sort of markers that are as good for looking at cancer. So it's hard to do intervention studies. You can't do a 6-year intervention study looking at cancer outcomes in 50,000 people. So you're relying on animal studies and epidemiologic studies. And as you know, with epidemiologic studies, it's hard to control for confounding variables. So it's a lot more difficult. But I do think, and have thought for 30 years, that early soy intake reduces breast cancer risk.
The one thing that I
quick
can
question. Can I ask one quick question about the allergenicity of the soy? Now, has anybody done a lot of studies showing why soy is among the big 9 allergenic food that we have today? What is causing this allergenicity of the soy?
Yeah, that's beyond me, but I will say my knowledge, there are multiple allergens in soy foods. I mean, that could be one reason, but so many foods cause allergic reactions. That's outside my area of expertise, and can't really answer. I'm not even sure it's known.
One thing to back up
I
the
just
clinical.
was wondering if there were some studies, but I think I have an idea, but I was just wondering.
What's your idea?
Well, yesterday I did a presentation on how the environmental toxins affect, for instance, peanut protein. And so the toxin overload may be contributing to the allergenicity of the protein by modifying the epitopes that the antigen-presenting cells and the other immune cells see. And probably that's what is driving the allergy in those foods.
So you think it's the herbicide or the genetic modification itself?
So no, all of the things that we do into the protein, all the pesticides, the herbicide, the fungicide, all of them combined affect the protein itself. It's like we talk about epigenetic modification in humans, so does it in the proteins. And once the proteins are modified, then the epitopes are different, and that is seen by the antigen-presenting cells as danger. And then they're picking it up and they're attacking it, and I suppose that's what is causing the allergies.
Yeah. I mean, that's an interesting theory. I have an allergist friend I can ask about that. Although I don't know if the prevalence or incidence of soy allergy is higher now than it was, 40 years ago. I mean, we've known about soy allergy for a long time, so I don't actually think there's been an increase, and it's still so much lower than so many other common allergens like milk and eggs and peanuts. But I don't know.
Well, just to back up clinically the effectivity of genistein for breast cancer. So me working in a cancer facility that does genetic testing, we also do genetic analysis for supplements. Genistein comes out in a lot of estrogen-dependent cancers. So this is something, again, that was done in vitro. But as you said, how can genistein stand alone on itself in relation to cancer treatment or even prevention is still to be determined. Because in this protocol that we do, we combine this with so many supplements and other even interventions such as low-dose chemotherapy. But one thing that I just want to point out there that it does have evidence in terms of its usefulness in such specific cancers, because it shows up in mostly in our breast cancers, ovarian, and even uterine cancers. That's why, again, the dose, you're right. The dose is to be determined. I mean, 150 milligrams 2 to 3 times a day, as recommended most of the time as supplements, but we can even go higher on that.
So wait,
And
can I interrupt you? Can you clarify
yes,
that? You're recommending 600 milligrams of genistein a day for prevention or treatment?
this is yeah, according 125 milligrams, at least 200 to 2 to 3 times a day as part of it's not reaching that much. So it's even less than 500 milligrams. The reason why we're confident in that is because we're using a genetic test that actually uses the patient's blood in relation to the molecules of genistein against it, and thus quantifying the killing capacity in relation to the amount of circulating cancer cells in that specific sample of the patient. So that's why, again, we're not making our money on that alone. We're putting other supplements that also is offered by this genetic test, and also other therapies that goes along with this cancer therapy protocol. But yes, the genistein is definitely having his own stance against cancer.
Yeah, that's really interesting. If you can send me anything, I'd really appreciate it if you have anything. But obviously, again, in humans, I mean, there have been short-term studies where isoflavones have been fed for like 900 milligrams of isoflavones a day, a few like that. But for the most part, the intervention dose is not going to be more than 100, and half of that would be genistein, so 50 milligrams. Now, in the one study, in one of the breast cancer marker studies, the subjects consumed 235 milligrams of isoflavones, but 150 was genistein. And they got in postmenopausal women, there was no effect on proliferation, but there was a increase in apoptosis. But that was really a large dose of 150 milligrams of genistein. That's rarely the case. So yeah, I'd love to learn more about that.
Okay.
I think all the questions of mine, Dr. Bill, are all X'd out.
Yeah, Dr. Catalpang states they inject phosphatidylcholine and deoxycholate sourced from soy for fat melting every 2 weeks. Are there any risks?
Can't say.
I don't think so either. So, we've been using that stuff for years. So, okay. Stefan has a lot of information on the chat that I don't really want to read. Do you want to have some comments or anything, Stefan?
Maybe I can counter this lecture with a lecture of my own. I've compiled a lot of research on this subject, including, a lot of these epidemiological and studies and where they really came from. And that's really the point, like who's funding these, who's researching these. And that's really important to understanding the results and positions of some of these institutions, like the dietetics societies, the AHA. We have to look back at the history of how these seed oils came to be. And then we also have to go back to how these things are created, the processing. We have to go back to the Maillard reaction, really. And so that's a lecture series that I want to give to you guys, is going back to food cooking chemistry, Maillard reaction, going back to that, because we can't be relying on these big studies because they are funded by sometimes people that are trying to sell you products.
February 18th.
Can I respond?
Go ahead.
Yeah, so first of all, I actually have the opposite take on it, because I think often the scary stuff is being promoted by people that are trying to sell you stuff or trying to sell you books. Whereas, and in terms of the American Heart Association, I've read all the articles about how it started out and what companies funded this and that. That's not really nutrition. That's another type of investigation. But when I look at the individuals who, it's not an organization, it's individuals come out with position papers, and they may have 10, 15 authors. A lot of times I'll know many of them, at least if not personally, by reputation. There's these people are like, you don't go into this field to make money. You don't become a researcher, a professor anywhere if your goal is to make money. I consider these to, in general, these people to be quite, above board, have excellent reputation. So it's not the AHA so much as it is the individuals that create these position papers. And in terms of the processing, I think processing is a very important consideration for seed oils. And I think probably one of, if not the main anti-seed oil person bases her concern on processing, not actually linoleic acid, which is the case for most people. But in that case, I think you look at the epi studies where people are actually consuming the oils, and you see if higher oil consumption is associated with the lower or increased risk. So isn't that something that you would consider to be of value?
You're muted there, Stefan.
I mean, I'm not really sure what the question is. I mean, we're talking about oils and if they decrease diseases.
Yeah, so what I'm saying, I'll repeat it. Sorry if I wasn't very articulate. In the end, you have the oil goes through various processing steps, and you can debate, is this too much of a compound or what happens compositionally to the oil? But in the end, if you look at what effect the oil has on health status, that's really the only relevant outcome that one needs to consider, is what happens for your disease status when you consume the oils. And to my reading of the literature, higher oil consumption is associated with a better health status versus lower oil consumption. Do you not agree with that?
I mean, the trends are not going in the favor of more seed oil consumptions. Everyone's getting sicker.
No, but that's, I don't mean to be picky, but come on, those are just the gross correlations, ecological observations. You look at individuals, not group data. You look at in studies of 50,000 people, and where you can control for a bunch of confounding variables, you look to see whether individuals in the highest intake group, whether it's the quartile or a quintile of seed oil intake or linoleic acid intake, has a lower cancer, diabetes, cardiovascular disease risk than people who are consuming the least amount.
So they're supplementing linoleic acid?
No, not supplements. They're actually getting it from the oils themselves. So these are observational studies where you record their entire dietary intake, and then you look at how linoleic acid intake is associated with risk of various diseases on an individual basis. That's how you do observational studies.
And who's funding these studies?
Not companies, that's for darn sure. These things are NIH funded. They're cost millions of dollars, millions and millions and millions of dollars. They've been going on for decades. Epic Oxford, I mean, they're just readily available in the literature.
Are they, well, I know I'm aware of Epic Oxford, but what type of oil are they using?
So they're recording what people consume for their habitual diet. So they can ask about the oil. If it's a study done in the United States, it's going to be soybean oil because it accounts for 7%. It's the number one edible oil by far. So if you're getting linoleic acid, most of it's going to be coming from soybean oil in this country.
Yeah, that's true. There's a lot of soybean oil out there.
I think, Mark, where it's coming from really is the omega-3 balance. And it's a very big debate here in the integrated field about omega-3s and omega-6s. And as I think the consensus here really is all about the balance. And there's an index that we kind of follow in relation to a higher index benefits more of, like, for example, cardiovascular. If you're higher in
the omega-3 fatty acid index?
Right. So this
Bill Harris,
again,
right?
Right. So as far as I've seen so many lectures about it and even debates, nobody wins this specific
No, but no,
conversation.
that's fine. That's fine. But Bill Harris created that index, right?
Mm.
And he's the one who leads the charge saying that the ratio is completely irrelevant. And he's on the paper. He's one of the authors on the paper that I suggested you look at if you want more information about that topic.
Right.
I mean, one of the things about the ratio, and again, look at I'm a soy guy. I've only been studying oils for 4 years now. And you can tell I talk about a lot of different topics, which means you don't have, the ultimate expertise on any one. But one of the things that he mentions, which I think makes so much sense, is you can consume 5 grams of linoleic acid and 1 gram of linolenic acid. That's a ratio of 5 to 1. Or you can consume, a half a gram of linoleic acid and 1/5 of a gram of linoleic acid, and it's still a ratio of 5 to 1. And those are completely different situations. So he says that you don't want to improve your ratio, lower your ratio by reducing linoleic acid intake. If anything, you want to improve your ratio by increasing more omega-3, which I, totally endorse. And it was also based on the assumption that linoleic acid is converted to arachidonic acid, and that just doesn't appear to be the case.
Yep. Again, the hot topic, and answers could be up to tomorrow.
So, yep. So you were worried you didn't have enough material, Mark. So,
Yeah.
it's,
Active group.
It's 10 of 7 here. I'm not sure where you're at. It's 10 of 10 in the East Coast. So
Yeah, that's where I am.
That's all of the questions we have. Do you have a short summary? You can give us a little wrap up.
Yeah, I would focus it on soy. Well, first of all, I think Nova ultra processed food is I think is in many respects may be doing more harm than good, because it's throwing out, it's causing people potentially to avoid many healthful foods. And I think for soy foods, I recommend 2 servings a day, and that could be a cup of soy milk and 3-4 ounces of tofu, ounce of soy nuts. It's a good source of protein. There's no downside to it. I think that's a reasonable amount. If you're going for cholesterol reduction, you got to focus on the 25 grams of soy protein per day. If you're looking at some of these potential benefits of isoflavones, then probably again about 2 servings is going to do enough.
Mm-hmm.
But there's a lot of good beans out there. It's not just all about soybeans. Just getting more plant foods in general seems to be beneficial.
So like in the hormone world, that reflex reaction from the so-called know-it-alls it turns out to be wrong. Right?
I hope.
Okay.
Is tofu in the Chinese restaurant safe? We're gonna go to Vegas and probably we'll go to eat Chinese food.
There you go.
Yeah, where
Is that safe?
Be careful with the soy sauce there.
Thursday night we're going out, right?
Yeah, I think Halas is starting to huddle up people.
So okay. So yeah, I'm gonna be there. I'm leaving tomorrow night. I'll be there and hope to see some of our friends who we only get to see you online here. There's a link here for something about Instagram copy, Stefan, whatever that's for.
Yeah, that's a new medical diagnosis I've identified. It's called Panda Express eye.
Mm-hmm. Okay.
Mm-hmm. When you go out to eat at Panda Express and then you get a hordeolum.
Well, there's your first mistake, is going to eat at Panda Express. I mean, who does that?
It's the high oxidative stress.
Yeah. Yeah, it'll last at least 24 hours. So
Yeah, I suggest that the group meets on Saturday. I will be there on Friday night, so I don't know.
okay.
In Vegas.
All right.
It
Well,
would
we
be nice
won't
if we can
be
meet
able to
them.
miss you, Dr. Tano. You with your new hairdo there. You're looking pretty sporty there with that new haircut. So we'll be looking forward to seeing you. Okay.
Yes.
Yeah, I'll be there tomorrow night, and I know Dr. Nario is going to be there, and Stefan, and anybody else. I think Dr. Quinn, who's not on tonight. Mark, we can't thank you enough for your expertise and your great information that you shared with us tonight. And we'll have the video ready as soon as we can, and we'll get you a copy of it. And who do we got next week, Dr. Mario? We got a Rose.
I think it's Mira Health.
Yeah, Mira.
Mira Care. It's a new type of hormone testing.
Okay.
It's newer than Dutch. So this is something that I think everybody would be interested in, especially the hormone aficionados out there.
So we're going to learn about some new hormone testing, and then the next 2 weeks are Tuesday night is Christmas Eve and New Year's Eve, and I'm taking off. So if anybody wants to host the webinar and find some speakers, let me know. So
we don't need.
So I'm taking 2 weeks off. So what? No good? You want to take it, Stefan?
Nah. It's Christmas holidays. We'll take a break.
Okay. All right. And again, Mark, thank you so much for you and Sarah, your assistant.
Thank you,
Mark. And we'll
Thank you.
We'll
And
be
Mark, I would contact you for those articles about countrywide studies and stuff like that. I think that would be good.
Okay.
Yes.
Thank you.
okay.
Yes.
All right. Thank you so
Bye-bye.
much. All right. Good night, everybody. Before we go, Dr. Burgess he's had a couple of medical setbacks. So I think the last I heard he had his gallbladder out, and then he was having some issues with that. So if you have a contact, I have his contact. If you want to send him, good wishes, let me know, and let him know that we're thinking about him. And with that, I'm going to say good night. I hope to see whoever's in Vegas. Don't be a stranger, and we have to go there and let them know who we are. Okay, so Dr. Ted, you can bring your myriad of books. He sent a thing online. I'm looking at your pancreas book, and I'm looking at it. It's 60 pages, 80 pages, 630 pages. I don't know how you do it.
Yeah, so that book is good because I wanted to see how we can help with Dr. Burgess.
Yeah.
And so if you guys can read it through quickly and come up with some recipes for him, that would be nice.
I'm going to have to give it to Dr. Halasa, and he can run it through an AI thing to give us a summary.
Some summary of that, yes. Oh, at the end of each chapter, there is a summary, by the way.
Okay. All right.
And let me know to find out, because I'm going there probably tomorrow to visit him, and he's really sick right now.
All right.
Yeah.
Well, you tell him we're thinking about him, okay?
I keep telling him that because you guys have been great. Thank you.
All right. Yeah, thank you.
Prayers.
For keeping us, keeping us in the loop, Marie.
Thanks.
Okay.
Yeah,
All
trying.
right. Okay, everybody. Anybody have any comments or questions? Again, if you have anybody wants to, Stefan, I got you for February 28th for that talk you just volunteered for. Okay.
All right. That's fine.
Okay. So we're good to go, and we'll see you Thursday night. We're going to dinner, right?
Yeah.
Yep. Okay. All right. I'll be there. I'm doing the brain workshop, so I figured I beat the hormone thing to death. I don't think I need to go do that again. So, okay. You're getting there when? You're not getting there till Thursday afternoon, right?
Thursday afternoon, yeah.
Okay. And Dr. Tano, you're not going to be there till Friday, right?
Until Friday, yes.
All right. Okay. We'll be on the lookout for you. Okay.
All right.
So, okay.
Thank you. See you.
Night.
Hopefully.
Anybody
Yes,
else going to
good
be there? Let us know. And if we don't, we'll be here next week, and then after that, we'll be off for a couple of weeks. And I want you to all, rest up, because New Year we're going to have some new good stuff for everybody. Okay. So okay. So good night, everybody, and please take care. Okay. Nighty night.